Styles of Teaching Part IV, Teaching and Learning in the Clinical Context. Changing perceptions of clinical teaching, the students, teachers, patients, teaching procedural skills, planning and implementing clinical supervisions. Perception of clinical teaching. Lack of planning coupled with poor supervision and feedback often blight clinical teaching. Clinical teaching focuses on real patients in clinical setting. The setting may be the hospital ward, outpatient department, surgical theater, or the community. The role of student in the clinical setting varies depending on their seniority and stage of the curriculum. A junior student may actively engage in the learning and not being a member of the team delivering the patient's care. Students may visit the ward in groups and be taught on a patient by unassigned clinical teachers. Students observe the teacher taking a patient's history or examining the patient. They also are required to reflect on the patient's case, and then feedback is given to the students. A more senior student participates in a clerkship as a member of the healthcare team. The teaching is integrated into the care of the patient. Now, what's the role of teacher in that case? The role of the clinical teacher is challenging, of course. He requires experts in the area of clinical practice and understanding of how they can facilitate student learning and awareness of the local curriculum and expected learning outcomes for students. Also, he needs to recognition of their position as a role model for students. Many studies have explored the attitude of a good clinical teacher. The skills required of a clinical teacher too often have been taken for granted, and it has been assumed that if doctors are good practitioners, they are also good teachers in that case. Unfortunately, this is often not the case, resulting in deficiencies and poor practice in clinical teaching. Problems identified include the lack of planning and proper supervision, lack of feedback to the learners, and a failure to appreciate basic educational principles and how students learn. Now, what about the patient? The patient is a key element in clinical teaching and may be a hospital inpatient, outpatient, or may be located in the community. It's very important to obtain full patient consent before students interact with patients. Patients' comfort and dignity should be respected. This is very important issue. Students can benefit from working with simulation, including simulated patient, mannequins, and computer representations. The range of patients seen by students in a clinical attachment should reflect the expected learning outcome. This can be recorded in portfolio, and any gap identified in the student's clinical experience should be remedied. Students who use an electronic handheld device to document their patient encounters, procedure, a more complete record. Patient can be selected for clinical teaching on the basis of their presenting problem, availability, willingness, ability to cooperate with students. Teaching procedures calls a 6-step framework for procedures learning has been proposed. Sawyer et al. 2015. Learn, acquire necessary knowledge. See, observe the procedure. Practice, develop the skill on a simulator. Prove, demonstrate mastery of the skill on a simulator. Do, perform the procedure on a patient, initially under practice supervision. Maintain, continue clinical practice on patient and simulators to ensure there is no degradation of the skill. Student progress. The clinical teaching assumes a more dominant role in the education. The clinical experiences and attachment increase in length from a half day to weeks or months. Students have increasing responsibility for patients and are assigned roles in the workplace. And implementing. The expected learning outcome must be clearly defined and communicated to the student, just like history taking, mastery of practical procedures, and an understanding of ethical issues. Appropriate learning opportunities, both formal and informal, should be scheduled in the learner's work plan. Teachers responsible for a formal teaching sessions should make the necessary arrangement for the session and should arrange for someone to cover their other commitment so that they are not interrupted by bleeps or other calls. The teacher can use skilled questioning for the student that aims arousing the learner interest. Like, how often do you think a general practitioner will see a patient with a thyroid problem? Testing the learner knowledge of a subject like, is this a reliable indicator that the patient is hyperthyroid? Promoting the student's understanding and encouraging the student to reflect on the topic and stimulate their critical thinking, like which of the treatment options available would you advise in this case and for what reason? Encouraging the learner to relate theory to practice. For example, what is the explanation for the patient tachycardia? Inviting comparison or different viewpoints. What's different in this patient from the last patient we saw? Consolidating the learning through encouraging the trainee to review and summarize the learning that has occurred. For example, what have you learned from the experience? Notes: as a teacher, you need to learn to be comfortable with silence. Give the students at least 3 to 5 seconds to think between asking a question and expecting an answer. As insufficient attention is paid to be the part of questioning in a staff development program, the skill lacking, even experienced teachers. It is important for the teacher to be a good listener, hear and understand what is being safe and respond accordingly. Nonverbal behaviors are also important. Try to maintain eye contact with the student. Feedback is very important to the learner. Clinical supervision. Responsibilities in clinical supervisor. Finding out the aspiration and career intentions of the trainee, recognizing the strength and weakness of the trainee, and adapting the training to the trainee's needs in that case. Meeting regularly with the trainee to discuss the expected learning outcome. Monitoring the trainee's progress and giving frequent and constructive feedback. Encourage the trainee to be reflective by keeping a diary or portfolio of the clinical case encountered. Being available for the trainee when support or advice is required. Offering counseling to the trainee if the need arises. Keeping the trainees motivated by being positive themselves. Also keeping their personal knowledge base and practice up to date. Thank you for listening.